Hello, and welcome to the American Massage and Chiropractic Conference pre-conference broadcast series on One Concept Radio. I'm Felicia Brown, and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing in Atlanta, Georgia, May 17th through 19th, 2013, and who are brought to you by One Concept. I'd like to take this opportunity to thank the 2013 American Massage and Chiropractic Conference sponsors, Massage Warehouse Scripts, MPA Media, ABMP, BioFreeze, and Massage Envy Careers for making this year's event possible. Our special guest today is Tina Allen. Tina and I will be talking about her 3-hour classes, Touch Therapy for Common Childhood Discomforts, and Pediatric Massage, highlighting the effects of trauma. But first, let me tell you a little about Tina. With over a decade of service to children and families, Tina Allen, founder of the leading children's health and nurturing touch organization, Little Kids Foundation, has become an internationally respected lecturer, author, and authority in the field of infant and pediatric massage therapy. Tina managed the United States' first comprehensive pediatric massage program at Children's Hospital Los Angeles and has developed pediatric massage programs at Mattel Children's Hospital at UCLA and Cedars-Sinai Medical Center. She is currently consulting on the development of comprehensive pediatric massage programs for numerous healthcare institutions internationally, including the Mayo Clinic, Nemours Alfred I. DuPont Hospital for Children, and Connecticut Children's Medical Center. She is a 2009 Massage Hall of Fame inductee, 2011 International Massage Therapist of the Year, and 2012 Massage Therapy Foundation Performance Health Humanitarian of the Year. Her innovative approach to children's health has allowed her the unique opportunity to educate families and professionals throughout the world in the many benefits of nurturing touch. Tina, welcome back to the American Massage and Chiropractic Conference pre-conference broadcast series on One Concept Radio. Thanks so much, as always, for taking time to talk to me about the event and your classes and, of course, pediatric massage.
Thanks so much, Felicia. I am excited to be here and really looking forward to the American Massage Conference. It's always a lot of fun and a great time to see yourself and everybody else that I miss seeing throughout the year. So I'm excited to be here and share some information and have a chance to chat with you as well.
Well, I can't wait to hear a little bit about your recent trip to Vietnam, which we'll get to shortly, and of course to learn more about the new class you're teaching on childhood discomforts. But I wanted to start by talking a little bit about something that's new for this year's conference. Part of the focus at this year's conferences is the idea of creating community by adding a community room where conference attendees can actually visit with speakers more personally and learn more about how they can make a real difference at home in our profession. So I'd just like to ask you, why do you think it's important to create community in the massage and healing arts world, in our practices or businesses, and, of course, at the conference?
Well, I'm actually really excited about this addition to the conference. When you shared this information with me and I was talking with the organizers of the American Massage Conference, and they mentioned this idea, I know that they've always been about community and bringing us all together in healing arts to work together. And it's something that I've always done in my practice. I collaborate with a lot of different types of healthcare providers and practitioners, and I always encourage it with all of the people that I work with, all of my students and the practitioners that I'm working with. And I just feel from a personal standpoint, when I have a bigger community around me, I know that I can do more of what I wish to do, and I have more people to share that information with, and I think that we work better together. I think we do more. I think we make a bigger impact when we're all working together as a big community. So I'm really excited about this opportunity. It's a different kind of networking opportunity, really. You know, a lot of conferences promote networking and coming and doing these meet and greets and meeting the people that you want to work with, which is wonderful. But to actually pose it as a community get-together so that we can work more as a collaborative a unity really is important. So I'm excited. I think that's going to be a really fun addition to the conference.
No doubt. I'm looking forward to seeing how it all gels together. And speaking of community, I wonder if you could tell us a little bit about how you and a team of massage therapists recently used massage to reach out and help children in Vietnam. I know you had a big trip the last time I saw you, so what can you tell us?
Well, we've every year the Little Kids Foundation participates in global outreach. So I will do outreach with a group in another country or another area that is in need of sorts of having education and hands-on care for the children. And so we returned just recently, a few months ago, to Vietnam. I selected 20 volunteers out of close to just over 1,000 applicants, which was an amazing opportunity in itself, just to have so many people interested in wanting to go. And the group that we took is of all different backgrounds. So not only massage therapists, but those that also are nurses and physical therapists, those that are providing early intervention and other kinds of care. So really creating that community of healthcare. And we went back to Vietnam. We'd been there previously. We went there 2 years ago. And it was amazing. Is the big kind of word that you could use to describe it. It's hard to understand how much of an impact I think that we made, but also what it does for each of us as an individual healthcare provider, to be able to use those tools and techniques and methods that you know to be useful at home in your country with the people that you're working with, but to be able to take them into another country and use them is nothing short of amazing. We had many different places we visited. We added new facilities. We work with everyone across all spectrums, so we're not really limited in working just with a certain population, but we work with people from all different backgrounds, meaning children that are in Buddhist pagodas, children that are being raised in government orphanages, so all different kinds of facilities, which is a really great opportunity. But to be able to also visit some of the places we were 2 years ago is amazing, to see how the children have changed and grown. One of my favorite stories that I've been so lucky to hear from one of the directors at the first facility we went there 2 years ago. She mentioned that they've been using the massage techniques that we taught them for the last 2 years. And when we went 2 years ago, they took the children to the hospital about 40 times a year on average. Since they've been using massage, they've only had to take them 2 or 3 times a year. And she credits the massage. She credits the massage, which is awesome.
Wow, that's breathtaking. That's really amazing. What a change.
Well, and I know that when we leave, our goal, we teach the massage techniques to the caregivers, and we also provide the care. Our goal is that it's sustainable and can be replicated and it carries on. And you do leave and you sometimes cross your fingers and say, I know they're really excited today when we left, and I'm really hopeful that they keep using it. I do keep in touch with the facilities when I'm gone, but you don't know. And to then be able to go back and see that they're using it and they see the impact is just wonderful.
You always take my breath away, Tina. I tell you, it just brings tears to my eyes to hear such an amazing story and to hear, just the fact that you go there and you do this and you're so dedicated, it is no wonder that you got that humanitarian award last year from the foundation. But my goodness, to have your work validated in that way and to make such a tremendous impact and have them recognize it, that's got to be an amazing feeling on your side.
It is. It is. I won't I won't even negate it. It is. You're in awe when you hear someone say that to you, because I do this and we've met, Felicia, and I know you know this about me. I do this because I love it, and in my heart I know it makes a difference, but to know that other people recognize it as well it's amazing. It's amazing.
I just should prepare myself more for these interviews with you, Tina, because I find myself going, how can I even go on from this? Okay, we just say the end. Tina's amazing. Go to her classes.
Oh, my goodness, no.
Well, people that haven't met you just are in for a treat, and so I really want to get into your classes and help them understand what magic you bring and how important the work it is that you do. But some folks aren't really familiar with pediatric massage. Can you just start by explaining a little bit about what it is and how pediatric massage and doing massage with children is different from working with adults?
No, absolutely. And some of I'll start it by saying, when I went to massage therapy school a long, long time ago, and I won't tell you how long because I'll date myself, but it's been a long time. And when I went to massage therapy school, they didn't talk about working with children. And so it was one of the interest areas I really became interested in. I originally went to school to be a pediatric occupational therapist. So I always knew that I wanted to work in healthcare with children, and I added massage as sort of an adjunct to that, but I fell in love with massage. So I stayed in that practice. And I was really surprised, actually, in massage therapy school that they didn't mention it. And the idea was just, ask their parents and work a little bit lighter, which isn't always the best approach. And that's one of the reasons that pediatric massage is different than adults, because there are a lot of different modalities and techniques that you can use safely with adult clients that you don't use with children. Children are growing and developing. Their bodies are different. Their cognition levels are different. So even the communication, the way that we speak with children is different than you would speak with an adult. You have different age developmental stages that you need to consider as you're working with them with a communication standpoint. And the reason I mention that so much is we always ask children's permission before they have massage. And so if you don't know how to communicate with them, that is something that's not going to work, because you need to have their permission before massage. And to know how to work safely is really important, how to work with children that are healthy, well, with typical development, as well as those that may have some different special healthcare considerations. There are different approaches and adaptations. So there's actually quite a big amount of information to learn in working with children so that you can approach them safely. The idea of just asking someone and working lighter isn't always going to be the best approach.
Well, that makes perfect sense to me, and I'm sure everyone listening is kind of having an aha moment if they haven't already. Now, you've worked with a lot of different kids in a lot of different backgrounds. I know some of the classes you've taught in the past at this conference have involved children with cancer, children with ADD, ADHD, and autism. And so I'm curious why you chose to focus one of your sessions this time on children affected by common childhood discomforts.
I know, it's a different subject. A lot of people think pediatric, and this is part of the reason why. When people hear the term pediatric, I think that some people think of healthcare. They think of a special healthcare need. That must be the reason that you would use massage, or they're in the hospital, or they're in hospice care, and so that's a good reason to use massage. But children, everyday well children, need massage as well. And I noticed that not many people are talking about that. So I wanted to take some time and bring light to the idea of using massage with healthy children and addressing some of their common concerns, because that's another application for pediatric massage that's really, really well received, but not used as much. A lot of people think of healthcare implications for massage, where children can benefit from massage just in healthy everyday life, and it makes a difference for them as well.
Well, I know how much of a difference massage makes for me as an adult, so it doesn't surprise me at all that kids would feel better, too. My goodness, there's a lot more stress in their lives, just even if they don't have medical conditions or diagnoses that are serious. There's lots of stuff going on that massage could make a huge difference. But, why would you say that the touch providers need to consider just common childhood concerns?
Well, part of it is, one, is we're trying to, with all of our work, I think, is help our clients to feel better, as much as that means. It's not a cure, healing anyone, and that whole piece, but just to help them to feel better, whatever that looks like. If they have, like a child may, just like you mentioned, have other stressors now or different anxiety than maybe we had as children, to know that massage might help them feel more relaxed or help them sleep better, would help them with growth and development, do better on their test taking if they're in school, do better in their peer situations if they've rested better. So just addressing sort of some of the common concerns actually helps them to flourish in the rest of their day-to-day life. Some of the concerns that I'm planning on talking about in this session are stomach aches and headaches, eye fatigue that we're seeing so much more of because children are on computers and iPads and other kinds of electronic gaming devices, or even their parents' cell phones. They're on those a lot more playing games, so we're seeing a lot more eye fatigue, and eye fatigue could link to headaches, so just being able to address some of those concerns. And then even constipation, which we all know that throughout life, just about everybody has constipation at some point. But I see kiddos in the hospital that have constipation to such a severe level that they're hospitalized for it. And massage doesn't always prevent or increase motility enough for it to pass. But if it could help in an outside of the healthcare setting, then they wouldn't be hospitalized for that circumstance. So they wouldn't have to have a surgery or something else. So just being able to look at this as more of a preventative and to help with healthy growth and development, it's a really important aspect that I think all practitioners should consider, because we want our clients just to feel better in day-to-day life.
Well, just the thing about the constipation with children, I actually have a friend whose son had to go to the emergency room with that very thing, and I taught her how to do gentle abdominal massage on him because they couldn't figure out what it was at first. And she said, do you think there's anything that massage could do? And I said, absolutely. Let me just show you some gentle strokes that you can try the next time his stomach hurts, because he doesn't immediately know that's what it is. And she said it really was a great thing. So I think that's it makes perfect sense to me. And teaching practitioners how to give this information to their own clients' children or to work with them in that kind of a situation is fantastic. So now
it's important and overlooked. It's definitely overlooked. And I think that we sometimes forget, just like you mentioned your client's son having to go to the emergency room, we sometimes forget that something as simple as we take for granted constipation can send a child to the hospital. So to be able to provide massage before they have to go there is important, really important for the whole family, not just the kiddo, because the parents are stressed as well when they don't know what's happening with their child. And if it was something that, as a therapist, I could provide abdominal massage, or if I could also show parents some techniques to use it in between sessions, if that makes a difference for them, that helps the whole family.
Without a doubt. Now, Tina, what's something that providers who take this class will take away from the session?
Well, we'll have a lot of fun. That's the first thing now. Seriously, we will. And we will take away a lot of information on different common childhood conditions, on what are some common causes of them, so that we might have some sort of symptoms to see what the causes might be, and then also how to address them. So we'll be practicing lots of different example protocols and I say example only because every single child is different. So I never teach a specific protocol and say this is the only protocol, here's when you apply it, you always do this protocol exactly like this. But we will practice protocols that could be used in their practice. So you'll leave as a practitioner from the session with techniques you can use right away in your practice and how to apply them safely, which I think is important, because sometimes you go to a session and you do all lecture and you leave with a lot of fabulous information, but you're not leaving with the hands-on tools that you want to use. And I know as hands-on practitioners, as those who practice in chiropractic and massage, you want to leave with hands-on tools that you can take home and use in your practice right away.
Well, I know I've been in your class before, and you do a great job of giving people things they can use, and you do make it lots of fun. So I have to just give the thumbs up on that and make sure people know she is totally serious. Tina is a fabulous teacher. Now, let's talk a little bit about your other class on trauma. I'm curious why, I can think of lots of examples, but I'd like to hear from you. Why do touch providers need to consider how trauma affects children?
Well, one of the things that there are so many causes of childhood trauma, so I think that's important too, because every child, the way that they process events or things that happen around them within their life, they process them differently. So how they will be growing up, it can also lead to other things in the future. So, for example, trauma is important because just the simple act, for example, of a family relocating could for the child cause trauma, or if the parents are divorcing or have divorced, that could cause trauma for a child. Some children will get over those type of events very quickly, and they'll just, maybe if they are in school, they'll jump right back into school. They'll make new friends if they've moved easily. They'll just look like nothing's changed for them, and so that can be for some children. But then there are other children that may be more withdrawn, or they could isolate themselves. They could be aggressive. They could be self-injurious or hurt themselves. It could also lead into other things that are even more than that. And, if there's bullying is a huge thing that's going on, even more so now with kids. It seems to be more heightened anyhow with the news media, and bullying causes trauma. And we're seeing an increase of the media showcasing suicides because of this bullying and other traumas that children are having. So there's a lot of things that we can look at with kids, and just how to make them feel better about themselves, how to feel more comfortable, how to help them address those stress and anxiety through massage, just helping them to feel more relaxed and having better body awareness. And those pieces are really important when it comes to massage.
Now, I'm curious, was there anything specific that made you decide to focus on this class, the effects of childhood trauma, as one of the topics at the conference?
Well, I think that there's not enough attention brought to it with how massage could be a safe intervention for these kiddos. It's a huge subject. I work with children that have trauma, often children that have had, in my practice, I work with children that are victims of domestic violence and abuse, not only physical, but sexual and emotional, as well as witnesses of. And so I've had a lot of experience in my practice working with children that have had trauma. And even one of the outreach work that we did was working with groups of tsunami survivors in Japan. And there were a lot of traumatic effects from that. So I've had a lot in my practice working with trauma, and I know that there's a lot of practitioners that haven't had that experience, or they have maybe even their own experiences in their life that they want to become more involved in being a supportive care provider for this population. So I'm just trying to make sure that we bring some more awareness that this is within our scope to work with these children. It's about how you approach them. It's not diagnosing. We're not diagnosing. We are just being supportive. And knowing safe approaches for all children is important, but then also if you have the background knowledge that a child may have had some trauma in their life, your approach may even be different, safer, which is important. It's just about putting the child back in charge of their own body, which becomes really important in all of our practice.
Now, this is something we haven't talked about before, but I'm curious, Tina, how do you go about getting that information about the trauma? I mean, I guess what the question that's coming to my mind is the parent always going to know about the trauma? And are you going to have that information, or are you somehow getting it from the kid, or how do you find out?
Well, that's, and sometimes you don't know. I mean, that's the interesting thing. Sometimes you don't know, and so when you don't know, and so let's pretend that's the application. You don't know. It's better for us as practitioners to assume, what if this child had ever had a traumatic experience? What would be the safest approach? Just so we approach them safely. So even if they never had a traumatic experience, the approach we would use would still be safe for that child, and it would also be safe for the child that has had trauma, which makes a difference because you sometimes don't know. Even when we have adult clients, we don't know. They may not even know. Sometimes there's things in their background that they don't even know, but once they're lying on the table having massage and body work, then that might come to a client. They have emotional release sometimes, and they don't know, and we don't know, and we're just there and we're supportive. But it's just better for children that we just set up the really safe environment. Sometimes you do know. If I'm working in a shelter, I usually have a background history. If I'm working in a healthcare setting, I usually have access to their treatment chart to understand a little bit more about them, and I can work with their social work team and other people to make sure we're really supportive and have some information. But you don't always know. The children don't always share everything. The parents don't always know. They may not even understand if they were, let's say, part of a natural disaster, like when we had Hurricane Katrina. A lot of those kiddos have effects from that very traumatic event. It was very traumatic for those who even were not part of it, those of us that saw it on the news or in the media, or when the Twin Towers came down and they did the 10-year anniversary. There were a lot of kiddos when they showed it in school who were under the age of 10 that didn't know what it was and didn't understand that it happened 10 years earlier. That saw it in school, and they kept replaying it all day, and kids didn't know why. They thought the world was being attacked, and they didn't know what was happening. So not knowing to approach kids safely from the beginning was the mistake in that aspect. So then you had to go back and work with all these kids that had some traumatic effects just by seeing it on the news. Some kids are more empathetic, so they're just different. So even if you don't know, just knowing how to approach a child for the what if is the big difference.
That makes a lot of sense, and I guess just assuming that every child has some type of trauma in their life or past is the safest bet possible. So I don't know that I would have approached it that way previously, but that makes a lot of sense to me. I'm curious, is there any sort of skill level or background that a practitioner needs to take this course or to do this type of work?
I think really just understanding that they want to learn as much as possible to be the best care provider is really so the open mind, the open heart is the best. If somebody really wants to focus their whole practice on working with children that are affected by trauma and maybe even specific elements of that, for example, if they wanted to work with children who were emotionally abused or physically abused or were part of natural disasters or events, then they would want to, of course, focus a lot in that area. So getting together all of the research data and reading and understanding sort of the effects that happen. There are a lot of resources for childhood trauma that someone could even do some self-study outside of the classroom if they wanted to. Just really to feel well-versed in that area would be important. But I think that anyone who wants to come to the session to be able to have some approaches to add to their practice, you could, knowing that you just want to be having a safe approach for every child for the just in case would be good for anyone to have. It would be good for everyone's practice.
Yes, I can totally understand that. I don't work with kids in my own practice, but I can see that if I ever was planning on adding that as a part of it, that this would be great information to have, along with all of your classes. Really, I have to say you're just a delightful instructor to be around and a wonderful person and a good friend. So I encourage everybody to take your class, all of the classes. Tina, for people that want to learn more before the conference, that don't want to wait that long, or maybe they aren't going to be in Atlanta or San Diego later in the year, how can they find out more about what you do, about Little Kids Foundation, and get in touch with you, et cetera?
Oh, sure. Well, I'll give you my website, which is probably the easiest. Of course, we're on Facebook and Twitter and everywhere else as well. So if anyone listening is to, by all means, please add us as a friend. We would love it. But our website is littlekids.com, and I will spell it for you. It has a phonetic spelling. It's L-I-D as in David, D as in David, L-E. K as in kite, I, D as in David, Z as in zebra.com. And we have a contact page and everything there. You can always call us, email us. There's lots of information on classes and articles and everything available on the website.
Well, that's fantastic. And I know people listening to today's broadcast are ready to come to the conference and register for your classes. That's Touch Therapy for Common Childhood Discomforts and Pediatric Massage, highlighting the effects of trauma with Tina Allen. Tina, thanks as always for taking time to talk with me today, and of course for choosing to be a part of the 2013 American Massage and Chiropractic Conference. I can't wait to see you in Atlanta, and we're just thrilled to have you at this year's event.
Thanks so much, Felicia, and everybody at the American Massage Conference. I'm just so excited to see everybody in Atlanta, and I hope everybody listens today and decides to come. It's a fantastic event. You will have lots of fun, and if you come to Atlanta, I have a feeling you'll also just want to come to San Diego. I wouldn't blame you. It's a conference that you want to come to year after year after year. So I just appreciate the opportunity to be there, and I'm looking forward to seeing everybody in Atlanta.
Well, thanks so much, Tina. I'm going to shift gears and make sure that everyone listening knows how to get involved in the conference this year. The American Massage and Chiropractic Conference is one of the largest exhibitions of massage and chiropractic products, continuing education, and business opportunities for practitioners of both disciplines. This year's conference will feature over 100 exhibitors, continuing education classes of 1 hour, 3 hour, and 1-day workshops, including Tina's. Other events during the weekend include Friday night's famous Facebook meet and greet, where the theme is disco, and the One Concept Gala on Saturday night. The new conference value pass is just $87 and includes access to all 1-hour CE presentations, the trade show, contests, events, community events, and more. And this year, we are also introducing the One Concept Pass. your ticket to full conference access. The One Concept Pass is just $349 and only $299 if you purchase early. It includes full days with James Weslowski and Eric Brown, all 3-hour classes, including classes with Whitney Lowe, Aaron Mattis, Tina Allen, myself, and all 1-hour presentations. All education is approved by NCB, TMB, and Florida CE Broker, and CEs are included for chiropractors. Also, the One Concept Pass covers lunch each day, as well as access to the trade show, the chance to participate in special events, community opportunities, and contests and raffles with literally thousands of dollars in prizes. For students, the conference offers a free Student Day and Smart from the Start program on Friday, May 17th, which is sponsored by Massage Envy, Massage Warehouse Script, BioFreeze, and Bon Vital. This day is dedicated to massage and chiropractic students who are currently enrolled in school or who will graduate in 2013 and includes access to our opening session and trade show on Friday. All of this is happening at the Sheraton Atlanta, and I definitely suggest you make plans to stay there if possible. Single or double rates are $129 a night, but space is limited, so make your reservations now. Also, MPA Media is printing the American Massage and Chiropractic Conference event program inside their magazines, Massage Today, Dynamic Chiropractic, and Chiropractic Insights. These will be given out at the conference and distributed throughout the U.S. to over 133,000 practitioners. So if you are a vendor or educator who's listening in today and want to get some great exposure for your class or product, contact Randy Gerson of MPA Media for details on being a part of the conference program. Now, if you're ready to register for the 2013 American Massage and Chiropractic Conference in Atlanta, and of course to meet Tina, myself, and the other amazing instructors, just go to www.oneconcept.com to access the conference schedule and register online. We also invite you to stay connected with us on Facebook at facebook.com/American Massage Conference and /American Chiropractic Conference. Again, the 2013 American Massage and Chiropractic Conference is made possible by all of our wonderful sponsors. Thank you so much to Massage Warehouse Script, MPA Media, ABMP, BioFreeze, and Massage Envy Careers. This is Felicia Brown, and on behalf of everyone from the American Massage and Chiropractic Conference and One Concept Radio, I want to thank you for tuning into this edition of the pre-conference broadcast series. We look forward to seeing you in Atlanta in May. Please also consider joining us later this year for the American Massage, Chiropractic, and Spa Conference in San Diego, California in September, and the Canadian Massage and Chiropractic Conference in October in Niagara Falls, Ontario. Thanks again for tuning in, and have a fabulous day.